Alright, hello guys. We're going to go ahead and continue on with our toxicology chapter. So yesterday we got a little cut off just because when it's over 15 minutes it starts to have trouble uploading, which is one of the reasons that, and I do want to respect your time when it comes to it. So today I want to go ahead and finish up our stimulants and get into like anabolic steroids and maybe even depressants. So I'm going to try to keep more focused than maybe I was in the last video. We left off talking about methamphetamines and some of the physical altering side effects that they have. So we mentioned the meth mouth. We can also take a look and compare their mugshots between previous years and more recent years, looking at specifically like the blisters and boils and rash-like appearances of the skin, also the loss of the fat tissue in the skin, giving their eyes and cheeks that sunken in appearance. Okay. To finish up our stimulants, here. So the three main categories of stimulants, at least when it comes to street drugs, you have your amphetamines, which are commonly called like speed. Sometimes speed is mistaken for ecstasy. So remember, ecstasy is hallucinogen, and speed is a stimulant. So two different types of effects that someone would get. But speed and ecstasy sometimes do look alike because they can sometimes come in a form that looks almost like a little like piece of candy, okay, almost like one of those sweet tarts. They can also come in like your normal pill or capsule shape too, but they can sometimes come in those colored candy looking forms. Okay. Other stimulants include your cocaine and your crack cocaine. So with crack cocaine, your crack cocaine is usually more pure and higher quality than just your standard cocaine, but you see the same effects and side effects of overdose with both of those. And then the last one we just got done talking about was methamphetamine or meth. When we look at these, now they're going to have similar characteristics when we look at someone who might be overdosing on them. One of the things that we notice that is different from the others is that with a stimulant, it tends to, if someone is overdosing on a stimulant drug, they tend to have a really, really high body temperature. So normally you're like 98.6. People who are overdosing on this, you would see effects like they're profusely sweating, and if you take their body temperature, they're probably well over 100 degrees Fahrenheit easily. And so with this body temperature that's so high, this is going to cause a lot of stress on the organs and can even cause organs to start to shut down. And so the first organs that tend to be affected by this would be like your blood and your cardiovascular system. So this leads into like high blood pressure. Oh, there's spelling errors all over this. High blood pressure, problems with like heart attacks, can lead into strokes and bleeding on the brain. So we notice that the very first symptoms is usually that high body temperature, but then can escalate fairly quickly to affecting your other major organ systems. Alright, our next category of drugs is anabolic steroids. So anabolic steroids, or sometimes they're just called steroids, they are synthetic compounds that are chemically related to testosterone. So they're not testosterone, but they're like a close cousin to testosterone when you compare the molecular compounds of these two. Okay, they kind of mimic what testosterone does. So, one of the reasons to use steroids is that it does promote cell and tissue growth and division. So, sometimes steroids can be given for injuries, okay, or even like skin conditions because it does have some medical benefits. But what we see is when people start to abuse anabolic steroids, they're typically using it to build up muscle mass. So people like weightlifters, bodybuilders, and other athletes will use anabolic steroids, sometimes unjustly, to increase their body muscle mass and even their bone mass at times too. Okay. However, with the overuse and abuse of anabolic steroids, there are some interesting side effects that come along with it. So your body, when it starts making testosterone, okay, it's kind of like where it's almost like your body can go into like a second puberty because of the high fluctuation of this testosterone-like substance. So think of the same things that happen maybe like in middle school. So like acne, increased body hair. What happens when too much of that testosterone type hormone, because you're actually messing with the hormones of the human body, and the fluctuations between steroid shots. This can lead into things like even baldness and high blood pressure, because with steroids, so steroids is a type of lipid. If you remember from biology class, lipids are like cholesterols and fat. And because steroids are in that same group of lipids and fats, it's going to lead to the same things that those lipids and cholesterol will do. So what happens is, over time, anabolic steroids can actually coat the walls of your arteries, which is literally what people do when they eat really crappy. So it's almost like that same person who's eating really crappy food, maybe McDonald's 7 times a day, and then the same person who's doing anabolic steroids, their bodies from the outside will look very different, but on the inside they're going to be having that same problem of high blood pressure, high cholesterol, leading to heart attacks and heart problems, heart disease, okay? Which I find interesting that from the outside they can look very different, and from the inside they might be having that same health issue. Also in males, with testosterone, too high of testosterone levels or testosterone-like levels from anabolic steroids can actually reduce sperm count, so you have impaired fertility in males. This can also go with females too. We typically focus more on males because males have a higher use of anabolic steroids than females, but it's not unheard of a female using anabolic steroids. And then certain type of cancers, some of the blood cancers, and then the prostate cancer and testicular cancers tend to go with overuse of anabolic steroids. Okay, we'll keep going here. Okay. So we already know that anabolic steroids, as I mentioned kind of before, super bad for the heart because it mimics what cholesterol does. Okay, it can literally coat the inside of your blood vessels, leading into things like heart attacks and heart disease. They can also have similar effects that alcohol does to the liver. So it can cause cirrhosis or scarring of the liver. And your liver, because it acts like the giant filter of the human body, once your liver gets destroyed, the rest of your body becomes very unhealthy because it's no longer catching all of the toxins and the wastes that it normally would. Okay. In teenage use, so if they find a teenager that is abusing anabolic steroids, typically this can cause even more bodily harm to them than in normal adults because steroids actually halt bone growth. So if you have a teenager who has not finished growing yet, okay, especially like with your males, since they will oftentimes continue growing even past high school, they might even not reach their full adult height that's dictated by their DNA. So if their DNA says that they should grow to be like 6'2", but they start taking anabolic steroids like their sophomore, junior, senior year, and they're only at like 5'8", there's a good potential that they will not reach even 6 foot. They'll probably stay at that 5'8" height. Okay, so they do not help when it gets into the bone growth aspect of things. Okay, so here are some names of some common steroids that are taken today. So Anadrol, Oxygen, Dianabol, Winstrol. So a lot of times, if people are getting steroids for like a medical purpose, whether it be to help cure an injury or for a skin condition, if they look at the ingredients, they might see some of these in the medication that they might be taking. But with these anabolic steroids, a lot of times people who abuse steroids will still use them, but they'll use them in a different form. They'll use them in an injectable form. And so they're using a much higher dosage, and they're using it more often than what should be prescribed by a doctor. On the street sometimes, or maybe not necessarily even on the street, but even like within the weight building or bodybuilding and weightlifting, trouble talking today, communities. These can be called, like their nicknames are called like Arnold's, Roids, or sometimes Juice as well. Okay. Now there's technically 3 ways to get steroids into the body. They can be injected through the veins or muscle tissue, which is how a lot of times people who are abusing anabolic steroids, that's how they usually get it into their body, because it's an easy way and one that works quicker. They can do it via oral intake. So, for example, some steroids like your prednisone, probably some of you have been on prednisone for infections or to help heal an injury, okay? Those are taken orally through like a pill or capsule, or they can be rubbed onto the skin in the form of like gels or cream. So a lot of times if people have like a skin condition, the doctor will prescribe like a cream that has steroids in it. But typically the amount of steroid in there is like 1%. Okay, definitely not nearly as high as what's getting injected into people who are abusing steroids. Doing the same thing I do in class, looking ahead. Okay, I'll go ahead and start depressants. That way I have a little less to cover in my next video with you guys tomorrow. Alright, so with depressants, depressants are kind of like what they sound. Depressants are substances that just slow down the normal function of the central nervous system. Okay, so they are the exact opposite of the stimulants. Stimulants help to focus in and maybe even help seem like the nervous system is working quicker. Depressants do the exact opposite. They depress or they slow down what your central nervous system is doing. Oftentimes these depressants can cause drowsiness and slowed brain activity, and they can also be used to relieve anxiety and produce sleep. So depressants, okay, are not the same thing as like depression. Okay, depression is like a mental health condition. Depressants are substances that are used in just slowing down. Sometimes depressants mimic some of the side effects that depression actually has, if that makes sense. Okay, depressants aren't used to fix or treat depression. Sometimes I get students who kind of think that they're the same thing, or they're used to treat one another. Exact opposite, actually. So, for example, like someone who needs a sleeping pill or sleep aid, okay, would take like, Ambient, I think, is one that's a fairly popular like sleep aid. I guess even like your ZzzQuil, which you might have heard of like commercials or seen it maybe at Walmart. Those are technically under the like depressants category. Okay, and mainly it's just because it helps to like slow down some of the messages that keep getting sent back and forth to the brain and allow that person to actually fall asleep. Works the same way as like your anxiety medication too. Okay. Now, side effects, especially when we're looking at depressants that might be used like on the street or illegally, side effects include slurred speech and a loss of coordination. Okay, someone who overdoses on depressants actually has the exact opposite of the symptoms that we saw with the stimulants. So overdoses with depressants can include slow heart rate, slow breathing rate, and it can even almost cause that person to go into like a coma and eventually death if they are not found and treated. Okay. Now, what the scary part is a lot of times people will take depressants and mix it with alcohol and other drugs, and with that mixing of drugs and other substances, that's when things can get really bad really quickly. But some of the examples of depressants, which we'll get into our next video, include barbiturates, benzodiazepines, and that includes things like, you might have not known that word, but you've probably heard of some of the examples like Valium, Xanax, Rohypnol, which is the date rape drug. Okay. Alright, getting close to time. I'm going to go ahead and stop right here. I hope you guys are doing well. As I sound all perky talking about depressants. That's weird. Oh well, I hope you guys are doing well. We'll go ahead and finish up our drug/toxicology chapter tomorrow. And then next week we start our final. Okay? I'll talk to you later. Have a good one.